So, good morning, everybody.
Good morning, sir.
Today's topic is syphilis. Today's topic is syphilis. Everybody, syphilis is caused by
Syphilis is caused by
Treponema pallidum.
Treponema pallidum.
Tripos means curved. Treponema pallidum. Treponema pallidum. Tripos means curved. Tripos means curved. Pallidum means stains pale. Everybody, Treponema means
Treponema means
curved.
curved.
Pallidum means
Pallidum means
it stains pale.
extreme pain.
It is sexually transmitted disease, STD. Which one? Madam, listen. Don't talk to each other. Any other sexually transmitted disease you know?
AIDS.
AIDS is viral. What is the long form of HIV?
Human immunodeficiency.
HIV stands for Human Immunodeficiency Virus. Everybody. HIV stands for Human Immunodeficiency Virus. It gives rise to what is? It gives rise to what? HIV gives rise to what infection in man? What is the long form of AIDS? Syndrome. What are the modes of transmission? How it is transmitted from man to man? STD 1. Okay. 2. NSI. Yeah. Next.
Blood transmission.
Blood transfusion 3. Okay. Then next. Any other? Any other? Or no needle stick injury. All of you should be very careful about needle stick injury because your day-to-day practice of nursing, you come across needle stick injuries. So, what are the other needle stick injury borne viral diseases? One is HIV. What are the other? Hepatitis B. Very good. Then HIV, hepatitis B. Then one more. HIV is over. AIDS is HIV. Hepatitis C. Very good. Blood transfusion. Diseases transmission by blood transfusion. They are called TTDs. TTD stands for Tirumala Tirupati Devasthanam. They are called as transfusion transmitted disease. TTDs. Transmission transmitted diseases. TTD. Transfusion.
Transmitted diseases.
What are they? If you take blood transfusion, all of you, how many years old you are?
18 years.
18. So, have you donated blood any time in your life?
No, sir.
I have donated 44 times.
No, sir.
Why should you donate blood?
Sir, new blood does.
Ah, very good. New blood. New blood will come. Very good. Any other reason? Lifespan of RBC is 120 days. Even if you do not donate blood, it is going to be destroyed in the graveyard called spleen. Okay, there are enough articles suggesting that if you donate blood once in 6 months, once in 6 months is once in 180 days. Although lifespan is 120 days, if you donate, your bone marrow gets stimulated, you get fresh blood, and which will be the blood, whatever you donate, you are going to donate only 350 ml of blood. It will be regenerated within 24 to 48 hours. And you need not have to apply Fair and Lovely cream to look beautiful.
Yes, sir.
You automatically become Fair and Lovely if you donate blood. If you donate one bottle of blood, oily, very oily, you not applied anything. When you are coming out in sun, you have to apply sunscreening lotion. Sunscreen lotion. Sunscreen lotion. Yeah, it's very important. So, not become dark or wrinkled. Okay. Now, very important is transfusion transmitted disease. No, the idea of telling is all of you should every hold like this. I'll take oath once in 6 months. I'll donate blood. Remember somebody who have died for want of blood in among you. Some of you must have born out of cesarean. Okay, cesarean requires blood. Oh, gee, this Malayali attitude I don't like. So the just remember somebody wanted a blood, died among your relatives and all those. Blood donation is the greatest donation on the earth. Why? Because although we have advanced so much, we are not able to create artificial blood. We are not able to. Blood is essence of life. Blood is essence of life. Blood, flood, money, and knowledge is meant for circulation. If you know something, you teach some. Become a teacher in your life. Knowledge is something should not be hoarded. You know something? Tell your friends. So, how do you study your nursing courses? You should make every day. You should make a timetable. Time to time, in the morning when you get up, you should have a regular timetable. Okay? You make a timetable, nice timetable. Every hour in the evening, what you want to read that particular chapter. Nicely make a timetable. Go by it. Then you should have a dream and goal in your life. Unless you what happens when you yawn? The knowledge will go to the oral cavity and disappear next day in the toilet. Okay. So blood is meant for circulation. Even if you do not donate blood, it is going to be destroyed after 120 days. So all of you should donate blood. All of you should donate blood. Okay. So there are two types of blood banks. One is voluntary blood banks. Another is professional blood bank. Professional blood bank. The people who donate blood are all auto drivers, truck drivers, and all those. They get money, 2,000, 3,000 rupees. They donate blood. All of this, don't talk. Keep like that. All of you should become teacher yourself. If you want to start, if you teach somebody, for example, you make a small group, you pick up one topic. If you don't have blackboard in your this thing, buy a roller board, or if you have a slate, old slate and pencil, you make a slate, write it and teach in your house. Then you learn the subject very well. Then you learn the subject very well. Okay. The blood transfusion, the diseases which are transmitted by blood transfusion are HIV, hepatitis B, hepatitis C, syphilis, malaria, cytomegalovirus. These are called as transfusion transmitted diseases. Transfusion diseases. Transfusion transmitted diseases. Transfusion transmitted diseases. So all this blood should be screened by before donation for all these infectious diseases. Is it clear?
Yes, sir.
There are certain diseases which are transmitted by from mother to child during intrite. Any of them, any of this in this class are married?
Yes, sir.
Who is it? Nobody knows. Nobody knows. Okay. These are called vertical transmission. Vertical transmission. Mother to child transmission. Mother to child transmission. These you remember with mnemonics torch. With the mnemonic torch. S for syphilis, Toxoplasma gondii, rubella, herpes, Hep B, Hep C, herpes. These are, please don't talk. That's why I don't take classes for you. All of you make so much of noise. You're not interested in the subject. These are very important. There is something called infection control nurse, and that is going to be the future of you. When you go to Saudi Arabia or Gulf or Dubai or even UK, US, infection control makes it very important. As an infection control nurse, you get a very good salary there. Okay, future of microbiology in infection control hospital. For example, if the patient is operated today, 3 days after that, if he gets an infection, nurses plays a very important role, collecting the sample, submitting into the lab, getting the report, and tell what antibiotic should be used for that infection. Now that's very important. All of you should learn infection control, hand washing, needle stick injury, screening for HIV, hepatitis. All of you are vaccinated against hepatitis B.
Yes, sir.
How many doses you have taken? 3 doses you should take before entering your 6 months up. Before you go to the clinics, hospital, you should take 3 doses. That's very mandatory of all this. Okay. So the fourth one is vertical transmission, mother to child transmission. Mother to child transmission. The fifth one is breast milk. Please don't talk. How many times I have to tell you? Please keep maintenance. Another half an hour. Can't keep silent. Huh? Why do you make so much of noise? All of you should concentrate whatever we are teaching here. It's very important. Something will go into your head. This comes after 40 years of teaching to the medical, dental, technician, nursing, pharmacy students. Huh? No, this you will not get in books. Experience. It all comes by experience. Okay. HIV stands for human immunodeficiency. Please underline that deficiency virus. It gives rise to acquired. Everybody acquired Immunodeficiency syndrome. Acquired immunodeficiency. The confirmed modes of transmission are confirmed mode of transmission sexual blood transfusion highest, blood transfusion, needle stick injury, sexually transmitted disease, mother to child during intrauterine life, and breast milk. So if mother is HIV positive, you don't allow her to feed the baby. Chances of transfusion is 30%, almost 30%. Syphilis is caused by sexually transmitted disease. If you are a nurse, if there is a genital ulcer, whether it's on the female genital tract or male genitals, don't touch with a bare hand. You have to wear a gloves. Wherever you see a blood and pus, you should always use a double gloves and touch it. So doctor or nurse can get syphilis on the hand. If it touches the syphilitic ulcer with a bare hand, touches with the syphilitic ulcer on the bare hand. Okay, and blood transfusion can give rise to syphilis, non-venereal transfusion, non-STD transfusion. So let us see. Syphilis is sexually transmitted disease caused by Treponema pallidum. Write down syphilis. Syphilis. Everybody write down. Syphilis is caused by sexually transmitted disease called syphilis. It is caused by Treponema pallidum. Tripos means curved. Pallidum means tripos means curved. Pallidum means it stains pale. Stains pale. Tripos means pale. Sorry, tripos means curved. Everybody do like this. Correct. Oh, that's the right act. So it is sexually transmitted disease. So it can be, there are various kinds of sex, oral sex, anal sex, and the primary ulcer. The primary ulcer is called as chancre. What is that, everybody? The primary ulcer on the genitals is called chancre. Everybody, chancre. 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 But there is something right for pregnant mother to vertical transmission by mother to child during intrauterine life. So confirmed modes of transmission are mother to child and sexually transmitted disease. Okay. So named after a poem published by Italian physician poet Girolamo Percasto, shepherd Hypsonilla named syphilis. Shepherd from Hypsoniola named syphilis, who angered Apollo and was given the disease as a punishment. So in olden days, plague, leprosy, and all these things are thought to be the shapa or angered god gives, you suffer from this. That is Ashirvada, not shapa. Suffer, you suffer. So it's a shepherd poem. Okay, Fracasto. Okay, Apollo gave him punishment. What is leprosy? Which organism causes leprosy? Leprosy. Mycobacterium? Yeah. No. Lepre. Lepre. What it causes in human being? What is leprosy? Huh? What is that? What is leprosy? What is leprosy? It is mycobacterial neurodermatitis. It infects the nerves and skin. So it eats away the all sensation is lost. He walks on the fire. He walks on the thorn, and all the muscle, the nerves, and the skin is eaten away. He becomes blind, and hands become clawed, face become leonine. Okay, the eyebrows and eyelashes are lost. Huh? Neurodermatitis. Okay. What happens to man in tuberculosis? Tuberculosis.
Sudden weight loss.
That is clinical features. Sudden loss of weight, evening rise of temperature, and most important is cough, which lasts more than 15 days. Cough. That is the cup, not cup. Cough. Cup is the drinking cup. Cough. Cough. Cough with hemoptysis. Hemoptysis. What is your name? Bindure Bindu. Okay. Hemoptysis means coughing up the blood. Hematemesis means vomiting of the blood is called hematemesis. Emesis, it occurs in ulcer, peptic ulcer. Hemoptysis occurs in the tuberculosis. So, why it is called tuberculosis? The lesion caused by tuberculosis, tuberculoma. It has central area of causation necrosis surrounded by monocyte macrophages, Langhans giant cell called. What is Langhans? It's a giant cell called Langhans. Okay. So described in 1900 by Shaudin, Hoffman, and Shankers, and inguinal lymph nodes of the patient. Caused by Treponema pallidum. Blood transfusion, sexual transmission, vertical transmission. Sometimes patients get infected by both. Take one, buy one, take one free. Nowadays, HIV is most important. HIV patients are also infected with hepatitis B, Haemophilus ducrei, Chlamydia trachomatis, and HIV. So, confirmed modes of transmission are sexual transmission, blood transfusion, mother to child transmission. सीमा जी, क्या देख रहे हो? किस ख्यालों में खो गए हो? सोच रहे हो समथिंग? क्या सोच रहे हो? ड्रीमिंग समथिंग? किसी बॉयफ्रेंड के बारे में सोच रहे हो क्या? नहीं, चलो. So sometimes person get infected with HIV and so description of this villain. Okay, write down. Everybody write down. Long. Everybody say long. Ah, slender. Helically tightly coiled. Bacteria. It's gram negative. Aerobic, microaerophilic, anaerobic. It shows corkscrew motility like this. Ding 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 ding. Ding ding ding. Background music that is. Corkscrew movement. You have opened corkscrew? Any bottle with cork you have opened? No. Corkscrew motility. Any bottle with cork, you know? No. So many bottles will come. That is not cork. Cork is like something with put like this. Then you have to put something like that. There is an instrument called corkscrew, like that, steel one. You have to open that. Corkscrew opened. Can be free living or parasitic. Best known for those caused disease syphilis and Lyme's disease. Write down, write down. Corkscrew motility. Or it also shows flexion and extension. Hold, everyone do it. Flexion and extension. Flexion and extension. Written? Syphilis is often asked in your examination. Full question. 100 marks paper. It's just like MBBS paper reverse. 75 only, whatever it is. So, Viva and this thing is. Viva is not there, I think. Internal is there. Wow. I am not teaching nursing, no?
Why, sir?
You make so much of noise in the class. All the Malayalis. So, length is 5 to 20 micron, and the difference between each, this curve is exactly 1 micron. 0.12 very thin, 0.1 to 0.5 ml, and fresh. It can be seen under dark field microscope, fluorescent antibody technique. Direct visualization, you can use the dark ground microscope. My first batch of students from Wayanad Medical College, all are in US and UK. No, first batch I taught in 2013. Okay, all are in USA and UK, and some of them are in Gulf, some of them are in Kuwait. They are doing extremely well. We had only 30 students first batch. How many of you are from Kerala? Raise your hands. Oh, big majority. You know the place called Wayanad? Ah, Wayanad Institute of Medical Sciences. Aster Group, Mupen, Azad Mupen. They have got Medicity in Kochi, and they have got 2 hospitals in Bangalore also. Okay. So this is under dark field microscope, Treponema pallidum. This is under Shankar in fluorescent microscope. This is congenital syphilis. If mother becomes pregnant and delivers a child, being normal only, it is difficult to survive. With congenital syphilis, you have so many problems. Infected mother to child, fetus in utero. Neonates may also infected during passage through infected birth canal and delivery. So this is saddle-shaped nose. There won't be a prominent nose, straight nose, saddle nose. Then some people develop deafness. There is a skin rashes. So many problems. Child born to syphilitic mother. This is called congenital syphilis. Saddle nose, Hutchison teeth. See, Hutchison was a person who injected himself the Treponema pallidum and studied all 3 stages are there: primary, secondary, tertiary. He died of syphilis. So axial, moves. Do not have flagella. It moves with the facial filaments. Filaments enables bacterium to rotate or flex and extension. Now cell wall it has got an axial filament. In cell wall, axial filament. Flexion, extension, flexion, extension, flexion. Flexion, extension. Corkscrew movement. Ten, ten, ten. You want to go back? Axial filament. Not bad. Keeping maintaining silence. I don't know. Very strange. Otherwise, class will be like a fish market. When you go to which most of them from which place? No, Kerala. Which place you come from? Ernakulam. You go via Calicut or via this? How do you go? Road. You do go via Kalpetta? No. Gundlupet, Kalpetta, and Calicut and all. No. Anybody has seen Kalpetta? No. Kalpetta, Bateri, and what is the other place? There is no place called Wayanad. It's a group of 3 districts. Written down? Okay. Cytoplasm is surrounded by trilaminar cytoplasmic membrane. Peptidoglycan provides rigidity and shape. It is a lipid-rich membrane. 3 or 4 endoflagella originate. Axial filaments are called flagella. Axial filaments are called flagella. Axial filaments are called flagella. This is a description of the organism. Okay. So whenever you are studying an organism, you should know the morphology, cultural characters, pathogenicity, clinical features, laboratory diagnosis, prophylaxis, prevent, and treatment. That you make a column of that, write everything. So cytoplasmic membrane is surrounded by cytoplasmic membrane, and it has got bacterial cell wall. How it is made up of? NAM and NAG. What is that? NAM, N-acetyl muramic acid, N-acetyl glucoman, held together by dipeptide chain. NAM and NAG. NAM and NAG, held together by peptide chain. So it's made up of peptidoglycan layer. So inside flagella are nothing but axial filament. So this is how special staining, Fontana's or Leviti's method. You see the trypanosome pallidum. Lemon rice. It will not come by eating. Name the organism which causes food poisoning. खाने से होता है. क्या होता है? Name the organism. क्या कुछ नहीं होता है ना? ठीक है. Food poisoning. Food poisoning. Name the organisms which cause diarrhea and food poisoning. बिंदु रे बिंदु प्यारे बिंदु बोलो. Simple organisms. Not heard of cholera? No, forgotten already. What is the shape of cholera? Shape. Comma shaped. Cephalococcus is grape shaped. Cephalo means grape. Cephalo means everybody. Cephalo means grapes. Strepto means serpent. Palm. Strepto means. Last two girls, come here. One of you come here. Come here. Sit here. Come here. What's your name? Huh? Arina. Alia Bhatt. Come here. You stay there only. You stay there only. You stay there only. You are Alia Bhatt, huh? Huh? Atulya. What we are discussing? Sit. Don't do. You are Malayali. Which place you come from? Idiki. Kahan hai Idiki? Bridge. Idiki Dam. Idiki Dam, the door opened and all flooded, water everywhere. No water to drink. Idiki. Okay. Idiki Dam is very nice. I saw it. What you are discussing? What you are discussing? Simple question. About chore. Or Malayali mess is very nice, no? Fish. Triponema. So please remember, it cannot be cultivated. Triponema pallidum cannot be cultivated. That's why I put a red board. Most pathogenic organism cannot be cultivated. So it cannot be diagnosed that easily. Triponema pallidum cannot be cultivated in the laboratory. So it is very difficult to routinely cultivate the organism and find out the cause of infection. They are stained pale, that's why they are called pallidum. They cannot be cultivated in the rabbit. Everybody repeat with me. Nickel strain. Not nickel. Nickel. NICHOL. Nickel strain. It is cultivated in the rabbit's testis. Rabbit's testis. What do you call rabbit in Telugu? Kundelo. Kundelo's testis. Testis in Telugu? Male reproductive organ. No. Find out. So it has. Five minutes. So they are destroyed at 41 degrees, inactivated by oxygen, soap, distilled water, arsenicals, mercurials, common antiseptic agents. There was a myth among the lot of people. Immediately after having sex, they used to wash their genital with their urine. They used to think they'll get rid of sexually transmitted disease by immediately washing their genitals with the urine. That is totally wrong. Okay, it's very fragile. Most common cause of infection is due to some abrasion in the skin. Sexually transmitted. It is transmitted to the fetus through placenta, mother to child. Retransmission from needle stick and blood transfusion. Mucous membrane through abrasion, dissemination travels to lymphatics, regional lymph nodes and body via bloodstream, and it can invade to the tertiary. It can give rise to GPI, right? General paresis of insane, right? GPI. General paresis. She has opened already attendance book. She is ready to go, closing all the books. So it has, for every word, it has got 3 stages. Somebody who knows syphilis knows medicine. That is saying. Somebody who knows Syphilis
Syphilis.
knows medicine
Knows medicine.
because it infects all the systems of the body, cardiovascular system, nervous system, genitals, everything it infects. It has got primary stage, primary, secondary, and tertiary. Primary, hold like this. Primary,
Primary, secondary.
primary, secondary, tertiary. Primary,
Primary, secondary, tertiary.
tertiary. Primary, tertiary. Latent is tertiary. Late is tertiary. Tertiary, it causes neurosyphilis, cardiovascular syphilis,
Lateral.
not lateral, late, late. It causes gamma, gamma, causes gamma. What is your name? What is your name, Mister? Huh?
Atulya. Atulya. Atulya.
Atulya. Okay. Atulya means what? Spacious. Precious. Okay. You are precious in what way? Some important characters. What is it? Primary, it causes genital ulcer called chancre. 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 Secondary, it causes. A, please. Madam, come here. What's, come here. Come here. Huh? Yan? Come. In spite of repeatedly telling not to talk to each other, why you are talking? What's your name? Huh? Anuja. What is the meaning of Anuja? What is the meaning of Anuja? You don't know. Who kept your name? Who kept your name? Parents. Huh? Mother or father? Who chose your name? You don't know. Who loves you much, father or mother? The answer has to come from not Bindu, from Anuja. What you are specially discussing? What is that girl? She is still talking. Come, madam, you only. Lady with the mask, come. पर्दा हटा दो, जरा मुखड़ा दिखा दो. निकालो. What is your name? Jeena. Jeena. मरना, हम मरना क्या? वो जीना. Jeena means what? Which place you come from? Which part? Idiki. You are also Idiki. Ernakulam. What is the difference between Ernakulam and Cochin? Cochin, Ernakulam. For your kind information, my daughter is in Cochin, Fort Cochin. Okay? But a nursing home called Sangeet Nursing Home in Cochin. Fort Cochin. No, she's an anesthetist. She owns a nursing home, not job. Owner. Please sit down. Don't make noise. Thank you very much for patient hearing. We'll continue in the next class. So happy.